Hello everyone, welcome to the CTV News on Calabash TV and on the Wave Radio 94.5. I am Lisa Joseph. The authorities in Martinique have confirmed that the 4 bodies discovered last week off St. Anne are that of 4 St. Lucia nationals. Efforts to determine the cause of death of the 4 men are now underway. The police are trying to understand in what condition the boat was when it capsized with its occupants. The report further stated that the death of the 4 St. Lucians are not linked to the disappearance of another boat from Fort-de-France on 5th of June with 4 men on board. The 4 bodies were discovered on Thursday, June 18 and Saturday, June 20 in the same area of St. Anne, Martinique. According to Martinique media, 1 body was discovered on Thursday at Ant-Obo, and 3 decomposed bodies were discovered by kite surfers Saturday night off Cap Chevalier. On Friday, the 5th of June at about 4 a.m., the unexpected vessel with 4 men on board reportedly left Martinique for St. Lucia. The 7-meter-long green and black vessel, which was powered by a 150-horsepower Yamaha engine, was expected to arrive here in St. Lucia at around noon the same day. The captain has since been identified as Wilfred de Turville, who is originally from Richford-Dennery. The boat was reportedly transporting groceries and was accompanied by 3 other men from St. Lucia, namely Rudolph, Kurt, Richard, and Alvin Tristan. And also the Marine unit is reporting that last Thursday, June 18, some 4 men left St. Lucia as well for Martinique in 1 vessel, and on Sunday another 7 men departed St. Lucia for Martinique, and they're trying to get all the identities straight. St. Lucia has a health crisis with poor attitudinal behavior at the core. That's according to Minister Alvina Reynolds. The minister says the public purse is being stretched in providing funding for a growing number of St. Lucians who are being diagnosed with chronic non-communicable diseases.
St. Lucia's 2010 population census indicated the numbers in diabetes: 7,138, and that was 5 years ago. Hypertension, 14,566, the silent killer. In 2012, cancer, cerebrovascular, stroke, diseases, heart, which is cardiovascular, diabetes, and hypertension, the top 5, accounted for 54% of total deaths in St. Lucia. Recent data collected by our epidemiology unit between 2009 to 2012 places diabetes as the 3rd leading cause of death in St. Lucia. Data collected for the period April 2013 to March 2014 indicates that the government of St. Lucia paid $1.4 million EC to procure anti-diabetic medication for our people, over $600,000 for anti-hypertension. Put these 2 together and you are over $2 million procuring medication for diabetics and hypertensives in only 1 year.
Minister Reynolds was at the time addressing the opening ceremony of the Surgical Health Fair. She told the gathering that at present some 50 nationals are on the waiting list for dialysis.
The question is, St. Lucia, should we as government continue to invest more in dialysis machines or educate St. Lucians about the need to change behavior? Our behavioral risk factor survey, sampling adults between ages of 24 to 64 years, and I refer to persons within the most productive parts of their lives. This was conducted in St. Lucia from March to August 2012. Analysis of the results indicates that our population is at high risk for NCDs such as diabetes. Some of the results of this survey point to the following: low levels of physical activity, overweight or obesity, and unhealthy diets. The impact of NCDs on our island and the Caribbean region is great. We have now described NCDs as a tsunami.
The minister's concerns were echoed by the Medical and Dental Association. The organization welcomed the initiative by the private sector entity, indicating that health officials need as many partners as possible to make meaningful change in the society.
Children in developing countries are 10 times more likely to die before the age of 5 than children in developed countries. According to the Global Health Observatory data, 1/3 of all female deaths are due to cardiovascular disease and stroke. The Men's Health magazine has stated heart disease, cancer, unintentional injuries, stroke, chronic obstructive pulmonary disease or lung disease, diabetes, influenza and pneumonia, suicide, kidney disease, and Alzheimer's disease as the 10 leading causes of death in men. It also stated that men are more likely to die from these diseases because women are likely to seek professional assistance earlier than men. Luckily, because many of these causes can be prevented, we can take steps to avoid them by knowing the symptoms, by having regular checkups by our doctor or our healthcare provider, and by taking steps to live a healthier lifestyle. Hence, we at the Medical and Dental Association welcome such an initiative by Sagicor.
And several health institutions and organizations participated in that health fair, disseminating information to the general public.
For the breast, they could do it either in the shower or lying down. So they use the ball of their fingers and then they go around in circles. And when they do the whole circle, when they reach at the nipple, they squeeze the nipple. So if any pus or any blood is coming out, then that means something is wrong, they have to get it checked. Sometimes not all signs that is cancer, but it could be something wrong, they have to get it checked. So when they're doing the examination, they look for lumps. But they could look on outside the breast, and if they get any abnormality, they have to get it checked.
Lily Daniel, I'm a nurse at the Victoria Hospital renal unit. The main cause of kidney disease, St. Lucian worldwide, is diabetes and hypertension. There are other causes, but the major proportion of people going into renal failure suffer from these diseases. So to prevent yourself from going into renal failure, you need to control your hypertension, control your diabetes, or make sure you don't develop these diseases.
My name is Lisa Hunt Mitchell. I work as the Chief Nutritionist for the Ministry of Health. We have a number of different types of smoothies that we would like the people to taste. We have some with all different types of vegetables and fruits that people can actually make at home. For example, we had somebody said she doesn't use kale, but then we have kale smoothies there, so then she has now found out a different way of incorporating kale into her diet. So this is the idea here, is basically to tell people that they can use any fruit or vegetable to make smoothies, and this is our way of getting the nutrients from their fruits and their vegetables for themselves and for their children. Instead of drinking soft drinks, instead of making juices that are very sweet, you can incorporate, use ripe bananas or pineapple or pawpaw, and these are natural sweeteners that they can use to make the smoothies for their children, and it's very healthy, and they don't have to add any sugar, because we know too much sugar in the diet can affect so many of our organs and cause diabetes, and even hypertension is associated with high sugar intake. So we want to ensure that they eat healthy.
I'm Patricia Emmanuel. I'm a reflexologist. I'm a massage therapist. I'm an esthetician, and we do reflexology, massage therapy. For most individuals that doesn't know about reflexology, what reflexology is it's a technique where we apply pressure to the reflexes of the feet. The body is separated into two parts, and this part is known as the meridian. The meridians have zones that is reflects to the zones in the feet. By working these reflex zones of the feet, we'll be able to identify what's happening in the body and work that body back to heal naturally the way God meant it to heal itself all of the soul.
Robert Huggins, Program Officer, Substance Abuse Advisory Council Secretariat. We have here a drug kit that covers essentially a lot of the more popularly known substances out there, the LSDs, etc. Some of it we don't typically find in St. Lucia, but you may find as well. I wouldn't say it's prevalent per se, but then there are cases where, for example, visitors might come in and bring small quantities that they introduce to the public. So we just want to introduce the people and let them know that, these are possible things that you could have. Other things like pain thinners and these things are dangerous to kids and things that sometimes parents don't see or consider might be a danger. So we want to inform them about that, letting kids, when they're drawing or playing with these things, doing their schoolwork and they have the paint thinner or they have the whiteouts and these things, to be in an open ventilated room to protect themselves. Besides that, we have the other typical drugs, the marijuana, the alcohol, cough syrups, ecstasy, heroin, these types of things. And of course, our very popular display of the different diseases or effects of tobacco smoke. It's basically an image that shows all the possible things that could happen to one's body as a result of smoking tobacco.
Basically, we wanted to just share a little about what happens at the Mental Wellness Center, because it's mental health is a subject that is still taboo in St. Lucia. A lot of people are afraid to come and see what happens. Even when they do suspect that there is a mental problem, they're afraid to come forward, they're afraid to come to the center. So we're trying to encourage people today not to be scared, basically, because there is a lot that they don't know about us. Okay, what we have on display is our art done by some of the patients at the center. Whether this is a form of therapy for them, what it helps to do is to help them focus, help them to regain an understanding of living and interacting with other people, as well as to help lessen their symptoms. So these activities are a form of therapy.
My name is Sheila Wilson, resident nurse of the St. Lucia Sickle Cell Association. Sickle cell is it's an abnormality of the red blood cells. It's an inherited condition. People with the trait, when you have two patients with the trait, there's a possibility that they would have a child with the sickle cell. Sickle cell trait, you are well until, but it's most parents found out that they have the sickle cell trait is when they have a child with the sickle cell condition. Presently, when mothers attend the antenatal care, the sickle cell test is done for them, and babies that are being born now, they are being tested. So from birth, they would know whether whether a normal trait or they have the sickle cell condition, and then they will be treated.
Still on the health front, 12 community leaders have been trained under the Vive Bien program that seeks to help patients with the self-management of chronic illnesses. The St. Lucia Arthritis and Lupus Association is licensed to teach that program. The trainees will be working in communities in Ancillary Canneries, Soufrière and Choiseul.
Our leaders have been selected with the cooperation of the Ministry of Health. We have 5 community health nurses or aides. We have 3 people, 2 supervisors and a caretaker from the NICE program. And then within Soufrière itself, we have community health workers that are interested in this program and have asked to be part of it.
They are going to be empowered to go out to conduct programs with clients and other persons, interested persons, caregivers, and others in the community, to be able to empower these people to be able to manage their chronic conditions.
Chronic disease is on a rise not only in St. Lucia but within the region, and SLALA and our Ministry of Health has seen it important that a program like this be rolled out to help people to self-manage themselves. Not just people with self-management, but either young or old people who feel they need the skills to cope better.